This presentation is on Cornelia de Lange syndrome. What is Cornelia de Lange syndrome, otherwise known as CDLS? Well, it is a rare genetic congeniality disorder that cannot be inherited. Individuals have well-defined facial features, upper lip abnormalities, and atypical growth. There are numerous physical and intellectual and behavioral differences among these individuals. This is labeled as an intellectual disability under the IDEA that ranges between moderate to severe. Some characteristics are that children with CDLS usually have low birth weight, are smaller in size and height, and have smaller head circumference, otherwise known as macrophaly. Facial features may include an upturned nose, eyebrows that meet in the middle, long eyelashes, and low-set ears. And upper limb differences ranging from small hands to missing fingers or forearms. And they have a cleft palate as seen in this picture to the right. Some of these individuals may also have a diaphragmatic hernia, vision or hearing problems, excessive body hair, heart deficits, seizures, and dental issues. Most of these individuals experience developmental delays that range from mild learning disabilities to profound intellectual disabilities. These are more specific to their executive function, which is beyond their intellectual disability, especially in mental flexibility and visual short-term memory. They have difficulty in sensory processing, which can lead to hyposensitivity and hypersensitivity, confusion, fixation by sensory stimuli, or inconsistent sensation of stimuli. They may have gastrointestinal or other somatic problems that may cause anxiety, mood disorders, or challenging behavior, including self-injurious behavior. This can also make it difficult for them to eat and contribute to slow growth intestinal differences. Individuals with CDLS tend to vocalize with a low-pitched cry or speak with monotone voice, so their expressive language is very limited. Some causes of CDLS is that a majority of cases, the mutation is not inherited, but it occurs as a new de novo change in an egg or sperm during the early fetal development. This is mainly caused by a mutation that occurs in either the HDAC8 gene, the SMC1A gene, the NIPBL gene, the RAD21 gene, or the SMC3 gene. The SMC1A, RAD21, and SMC3 gene mutations cause milder signs and symptoms, whereas mutations in the HDAC8 gene causes a somewhat different set of features, which may include a soft spot on the head, widely spaced eyes, or dental abnormalities. Variants in any one of these 7 genes, all of which have structural or regulatory function in the cohesion complex. Prevalence. It has been estimated that the CDLS occurs in approximately 1 in every 10,000 to 30,000 newborns in the US. It is equal in gender, so male and females appear to be affected in equal numbers. A person with CDLS can live a normal lifespan unless they may have recurrent pneumonia, intestinal issues, or congenital heart deficits that are not identified or treated properly. On the right, we have a diagram of how many patients are identified within the prenatal diagnosis, at birth, within the first week or the first year. Some interventions, supports, services for students. Students may be able to receive therapeutic interventions such as occupational therapy and physical therapy. During the occupational therapy, they will look at the developmental milestones as well as the child's function and muscle control, posture, breathing problems, whereas in physical therapy, they will focus more on the stretching of muscles. Early intervention is also an option. This can assist with feeding problems, hearing and visual impairments. During the early intervention, families may receive an IFSP. Many children with CDLS who were diagnosed at birth or before age 3 may have been receiving services necessary to facilitate their development through an individual family service plan. Once they have aged out of the IFSP, they may receive an IEP during their school age years. This will allow them to receive accommodations and modifications to help their educational process. Although for some children with mild form of CDLS, the disability might not be evident and they might not receive all of the services in the IEP that they need. Intervention supports and services for parents. CDLS Foundation. This is an organization that has a family service team that supports families by answering any questions or being there just to listen. So this is more of a support group. They offer information on how to transition into adulthood services. So they assist in mapping out an educational plan with your child, socialization, pediatric to adult health care, and living arrangements. Another service that is provided to help families is called NORD. This is an advocacy facility for needs of the rare disease community. They support individuals with CDLS and families by providing them with resources and information. For example, mentorships for patient organization or professional education. Some intervention support services for educators. Providing targeted evidence-based instruction, such as direct instruction, or providing accommodations allows barriers to be removed and creates more of an educational opportunity for the student, such as extended time or complete assignments. Another technique that educators can use to help their students is management strategies that include environmental enrichment strategies. This allows to stimulate cognitive and learning abilities. So an example of this would be to give a student a memory aid, such as a day planner, or instructions to write down classroom assignments. This will allow the visual short-term memory, and assist with that.